name is Shauna. I'm a nurse practitioner. I'm going to be doing a neurological exam on you. Can you tell me your name and birthday?
Beverly Ramos, 12/8/1973, and I am 45 years old.
Great. And you know what year it is?
1970. Oh, actually, I'm sorry. That was my date of birth, 2018.
Okay, great. The neurological exam consists of mental status, speech, cranial nerves, motor function, and reflexes. So the first cranial nerve one is olfactory. I'm going to have the patient occlude one side of her, one nares, and I'm going to have her smell. Tell me what you smell.
Coffee.
And occlude the other one. And,
Coffee.
okay, she identified coffee correctly. The next cranial nerve is the optic nerve, which we're going to check for structure behind the pupil, and the optic nerve and the optic disc. I'm going to turn my light on. I'm going to adjust it. Yeah. And I'm going to, with my right eye, look at her right eye. And I'm going to go in and see the red reflex. And you can see the optic disc and the optic nerve and the reflex. And I'm going to do the same left eye to left eye. Go in. Okay. Open your eye. Okay, there. And I can see the optic disc, optic nerve, everything's intact. The next nerve are the 4 and 6, and it's texting for extraocular eye movement. And I'm going to do the 6 cardinal signs of gaze. I'm going to have her look at my finger. I'm going to have her follow my finger just with her eyes. I'm going to have her look at my finger and follow it in, and that's going to test for conversion, which she did well on that exam. Did not skip cranial nerve 5. I'm going to do that now. That's the trigeminal sensory and motor function, which I'm going to have her clench her jaw and then have her move her jaw side to side. And she was able to do that. And I'm also going to check the sensory nerve with a Q-tip, which again, we're going to pretend this is a Q-tip, and I'm going to rub her cheek and see if she can tell which side is soft and which side is dull.
Soft.
I'm going to check both sides.
Soft.
And then the sharp. And she was able to tell the difference between the two. Cranial nerve number 7, I'm going to have her smile, frown, and puff out her cheeks. And there was no deviation or distortion there. Next, cranial nerve 8 is the acoustic, to check her hearing. I'm going to have her cover one ear. I'm going to say a 2-syllable word, and she's going to repeat it.
Baseball.
I'm going to go to the other side, have her cover the ear.
Apple.
And she was able to hear me with no problem. Cranial nerve 9 and 10 is going to be the glossopharyngeal nerve and vagus nerve. I'm going to have her test her swallowing and observe her soft palate. So first I'm going to have her swallow. She was able to swallow with no problem. I'm going to look inside her mouth. Go and her soft palate is intact, and her uvula is midline as it should be. Cranial nerve number 11 is the spinal accessory, and it's going to test her hands, shoulders, and chin. So I'm going to have her put her hands out, and I'm going to try to press her fingers in. She's going to resist me. I'm going to close them, have her open them. She's going to resist me. I'm going to press on her shoulders. She's going to resist me. And I'm going to put my hand on her chin, and she's going to resist me as I try to push. And she was able to do that. Cranial nerve number 12, which is the last one, is the hypoglossal test, which I'm going to have her stick her tongue out, and it's midline, if there's any deviation that would indicate a brain injury. Deviation to the left would mean a brain injury on the left. Deviation to the right would mean a brain injury on the right side, which she does not have. Next, I'm going to move on to the motor function test. This is going to include coordination, look for any involuntary tics, and test her muscles. So the first test, we're going to test her triceps and do range of motion and just see if she can move her arms and check for muscle tone. And she's in bulk, and her muscles are not flaccid. She's got good muscle tone. The strength of her hands, I'm gonna press down. She's gonna resist. I'm gonna press up. She's able to do it. I'm gonna push her elbow in. She's gonna resist. I'm gonna pull it out. She's gonna resist. I'm gonna do the same on the left side. She's gonna resist. I'm trying to push out. She's gonna resist. And now I'm gonna have her go lay on the bed real quick. And I'm gonna check her knees. So I'm gonna press down. She's gonna resist me. And she go behind the knee. She's gonna push down and resist. I'm gonna push down on the other knee. She's gonna resist. I'm gonna pull up, and she's gonna resist. Next, I'm gonna check for her. Put her knees up. I'm gonna try to open them. She's gonna resist me. I'm gonna try to close them. She's gonna resist me. I'm gonna press on her feet. I'm gonna have her push up, push down, push up, and push down. And she's able to perform all these without any difficulty. Next, I'm gonna have her stand up, and we're gonna do a coordination test. I'm gonna have her walk, just walk normally, or just walk, and then walk back. And then she's gonna do, heel to toe. And she can do that with no problem. And then she's gonna go back and walk on her toes, which is, and then on her heels, which is called the tandem walk. Okay, and she's fine with that. So now she's gonna sit down. No, just on the chair.
Stay on the chair? Oh, I'm sorry.
Yeah. And we're gonna do rapid alternate movement with her hands to make sure she can have her and flip them over and do it as fast as you can. Okay, great. And she was able to perform that. The next test is the point-to-point movement. I'm gonna have her point to my finger and point back to her nose and see if she can do it. Okay, and she was able to perform that. The next part of the exam is the sensory function, and we're going to test sharp, dull, and see if she has any loss of sensation on either side of her body. The first one is the stereognosis. We're going to have her close her eyes, and I'm going to put something in her hand, and she's going to tell me what it is.
A coin.
Okay, and I'll put it on the other hand.
A coin.
And she was able to tell me. The next part of the exam is gravesthesia. I'm going to write a number in the palm of her hand, and she's going to tell me what it is.
A number 3.
And I'm going to do it on the other hand as well.
A number 7.
And she was able to tell the difference. The next exam will be point of location. I'm going to have her close her eyes. I'm going to touch a part of her body, and she's going to tell me where I'm touching when she opens her eyes. Close your eyes. Open. Okay, close your eyes. Open. Okay. Close your eyes. Open. Close your eyes. Open. Okay, she was able to perform that. The next is the oh, the 2-point distinction. I'm gonna touch her with something that has 2 points, and she's gonna tell me whether it's 1 point or 2 points with her eyes closed.
2, 1, 2, 1.
Okay, she was able to distinguish between the two. The next test will be extinction. I'm gonna touch one part of her body. She's gonna tell me if she feels one or me touching both sides.
1, 1, oh, oh, 1.
Okay, she was able to perform that as well. Next one, we're gonna do the check the deep tendon reflexes. I'm gonna check the radio. Brachialis, I'm gonna tap the hammer on my thumb and see if she has reflexes. She has very strong reflexes. I'm gonna check the bicep and do the same thing. And again, I'll do both sides. Tricep, and then we'll check the bicep, and then we'll check the tricep. And she's has great reflexes. Next, the patella, which is the little notch right below the patella reflex, which is right below the patella. Great reflexes again. Okay, she's got great reflexes there.
I love it.
I know, it's fun, isn't it? And then I'm gonna check the Achilles reflex in the back on both sides and check for her reflexes, which are normal. Next, I'm gonna do the cutaneous reflex. I'm gonna have her lay on the bed. And come around this side. And I'm gonna just touch her abdomen with an object and lift her shirt up, and I should see her muscles twitch, which I can see that just great. And the next one is testing the Babinski reflex. I'm going to take this and go from the heel of her foot to the ball, and she'll dorsiflex, plantar flex, and then both sides, and she's got great plantar reflexes in her feet. That concludes my neurological exam. Thank you very much.